Well, injuries are a part of any season, which is why we have partnered with AHN Pavilion at the Erie Sports Center this NFL season. We're going to take a look at the hip injury to Bills safety Taylor Rapp ahead of the conference championship game.
It's a very interesting clip that we saw. I mean, to two different angles. On one of those angles, we really see that, his right leg really went into a hyperflexion injury where his knee comes up and right towards his chest. And, when you have a contact injury and it's a forced hyperflexion injury, a few things can happen. I mean, you can certainly, on the backside, stretch out your hamstrings, pull a hamstring. Or more on the anterior or the front of the side where, he was complaining of that hip pain, that can actually irritate the hip joint itself. The hip joint is a ball and socket joint, kind of like the shoulder joint. And, when we hyperflex, we can actually, kind of nudge that ball into the socket and hit it in at an interesting angle. Now, what exists between the ball and the socket is actually the labrum. And the labrum is essentially this soft cartilaginous structure that gives a little bit of cushion and suctions the ball inside the socket. And so that labrum has a potential of being torn. And I think that's really the big thing here of let's see what it shows. And if it's a labral tear, that can certainly require a lot more aggressive treatment and a longer recovery compared to, another type of injury. And that's really hard to say without imaging, just to, again, if there is more damage to any of the structures of the hip joint itself, let's say there's a labral tear. I mean, that could possibly even require surgery and weeks of rehab, and it can take months for them to get back to that 100% level. Of course, when it comes to professional sports, they take a lot more conservative of approach and make sure they're back only when they're absolutely healthy. But considering this was more of just a contusion of the ball hitting the socket or just a strain of a muscle, that can be a lot quicker of a recovery of days to just a couple weeks. That's one of the risky things about returning back to play when you're not completely healed yet, right? And so, that's really what you have, part of the whole medical team to help decide when it's safe to return back to play. I mean, the doctors certainly have their aspect, but we also have physical therapists, we have athletic trainers, we have strength and conditioning coaches, everyone who does an assessment of different areas of strength, of range of motion, of speed, running, cutting, things like that, just to see does that match their pre-injury baseline. And so, if he does go back and play, it would be very interesting to see if we would be able to tell from just the viewer's perspective if he's performing any differently or below the level that he usually does. But anytime you return when you're not back at 100%, there is an increased risk of re-injury or possibly injuring something else. And so, but it's always about weighing the pros and cons of, how important the game is, how medically recommended it is to go back into play.